What do you do with the sad that you feel?
I'm Dana Winters. I'm the faculty director for the Fred Rogers Center for Early Learning and Children's Media at St. Vincent College. The Fred Rogers Center was established to extend the philosophy and legacy of Fred Rogers into real-world actionable ways today. An important collaboration for us recently has been with Excela Health and also with Seton Hill University, where we have begun to use the work of Fred Rogers, the wisdom that he's left for us, the philosophy that remains, to serve children who are experiencing grief and bereavement.
I'm Maureen Cedro. I'm a bereavement counselor for Excela Health Home Care and Hospice, and part of the work that we do is offer emotional support to our families. We did a really good job talking with adults about their loss, but we didn't really know how to talk to children. So of course we would turn to the Fred Rogers Center to access the wisdom of Mr. Fred Rogers, who above all else knew how to talk to children.
When I was very young, I had a dog that I loved very much. Her name was Mitzi. And she got to be old, and she died. And I was very sad when she died, because she and I were good pals. And when she died, I cried. And my grandmother heard me crying, I remember, and she came and she just put her arm around me, because she knew I was sad. She knew how much I loved that dog. And my dad said we'd have to bury Mitzi. And I didn't want to. I didn't want to bury her because I thought I'd just pretend that she was still alive. But my dad said that her body was dead and we'd have to bury her. So we did.
Here at the Fred Rogers Center, we do hold the archive of Fred Rogers, which is about 19,000 cataloged items from his life. From that, we were able to pull some of the teachings, some of the episodes, some of his writings of what he said about childhood grief, but also some of the very honest dealings that he gave us of how we work with children during difficult times.
My daughter passed away from a postpartum hemorrhage May 15th, 2018. And after the shock had worn off, we really got a good picture of the devastation that happens when a child loses their parent. Besides the emotional part of it and the grief, there's all kind of aspects to it for the kids, and them still talking about their mother and things like that. And so we just never thought we would be in that position, but we were just kind of at a loss.
One of the wonderful considerations when we were putting together the program was to develop it in a way that when children are 5, they can come and be with us. And when they're 8, they can come back. Because as they grow, their understanding of death and loss changes.
Well, I thought it was important for us to learn, and also as a group to be consistent. So the more of us that would come to the classes and understand kind of what the program is, what you're looking for, things you need to do, way to have conversations, way to answer questions that come about, I thought that would be very helpful.
I'm Christie Walter, bereavement counselor and art therapist with Excela Health Home Care and Hospice. And as an alum of Seton Hill University, I was really excited to bring this program to my own community. So growing up watching Fred, he became my hero because of the art lady, who in turn is an art therapist named Judy Rubin. She is a huge inspiration for everything that I've learned about child development and the importance of using art with children and their families.
I think it is important for the family to understand how your child is going to behave or expected to behave. Young kids are really different. So they'll talk about it for a few seconds and then they'll just move on. You know what I mean? and then they'll come back to it, but then they move on very quickly. It's hard to engage them, to get them to keep talking to you about it.
The goal of my piece as the art therapist within this program is to really give the gift of coping skills. Coping skills through verbal language, nonverbal language, and being able to utilize that to bridge the gap between these children and their families.
I remember back to like the Fred Rogers and in the neighborhood. It was always about different emotions, the shows. And, you know, don't know if the kids really grasp it, but it would be about different emotions. It'd be about being sad, being happy, you know, those kind of things. So I think that's where I see the fit.
Children tend to grieve in sporadic moments, whereas adults really struggle with understanding that because theirs is more continual. So there's these lapses in times where adults begin to think children are okay because they're not bringing it up verbally. That's where we need to change the shift and input the creative process so that can continue that conversation between the two.
Listening to the children just tell their stories and talk about their feelings. And as they leave at the end of the evening, they're laughing and singing and dancing. It's been a benefit that I would have never expected. It's just so beautiful to see them to be able to find a safe space to talk about what they're carrying in their little hearts and on their little minds. And yet, at the end of the day, they're still laughing. That's the beautiful part.
So there's a lot of grieving kids out there, in the whole age range from 1 to 18. So that kind of makes us happy that we can help.
One of the most iconic Fred Rogers quotes is to look for the helpers. And that comes from a conversation with his mother, when he told his mother that he was afraid and asked her what he should do if he's afraid. She said to look for the helpers, you will always find someone helping. But there's a little bit more to that quote that we didn't know about before really diving into the archive. And that's the reason why his mother told him to look for the helpers. And it's because when you see people helping, you'll know there is hope. And I think that's exactly what this project provides.